Today, our next speaker is Professor Farida Fortune from Queen Mary, University of London. She's graduated both dentistry and medicine. She is professor of medicine in relation to oral health in the Center of Clinical and Diagnostic Oral Sciences. And she is also hosted the conference with Professor Alam. Please, the floor is yours, Professor Fortune. And sorry, the title of the presentation, I'm sorry, is The Knowledge Environment. Please, the floor is yours.
Hello, thank you for asking me to talk today. And thank you, Prof. Alam. I absolutely enjoy and adore working for you. So as I'm going to talk about the knowledge environment, whether we always have the new or does sometimes the old have quite a lot to teach us. I'm going to try and use mine. Okay, so this is us, and we're not alone, neither inside of us or outside of us. And I think we always act here as though we are. So we have an interaction with our environment, both internally and externally, and our cultural and environmental, as well as our genetics, will actually determine our lives, and what we do with it will determine the lives of everything and everyone around us. Next slide. Okay, so I'm really passionate about the sustainable goals, and I think we have a good global engagement strategy with WESD. We also need to have education and health strategies, and as Prof. Chidzonga said, it's really important that, you know, people have ownership. So when things like COVID happens, that although it's global, locally it can be implemented. World-class education research, working with industry is important, and policy partnerships. So I'm very keen on governance issues. We have a global society, and as today, we have a really good community of friends. We really have to embed it in policy and governance. And as John Buchanan said yesterday, that, you know, you have an audit cycle where this is looked at constantly. So education and health strategy, we cannot actually work in isolation. We have to work together, whether you're in medicine or engineering or in a policy institute or in a history. We all have something to contribute, as well as you can't work in health by having one specialty or having a generalist. All have to work together. That way you can innovate and you can work with industry with good outcomes. However, I think we've all forgotten our work has to be complemented with local and traditional communities, because they have ownership of health. So here's the wedding cake image, and it's the hierarchy of dependence. You saw this yesterday, and it just shows you how society as a whole, locally and globally, are all interconnected. Next slide. Okay, so how does the environment, health, and education, how do we make better health for all? So I'll talk about our local community is in the East End, but you could see you need to have health provision and take into account your environment, your evolutionary biology, which is your genetics, inside of your human microbiome, and as we spoke today, the psychosocial impacts from environment and to environment. So I think we should start working using anthropogenic structures, looking at health outcomes. As I said, it's interdisciplinary. So in our university, we are looking between the medical school, the hospitals, the university, and the policy institutes. Innovation, you know, everyone can innovate, and it's not the domain of the few experts. Next slide. So for better health for all, which again I'm passionate about, you cannot look at one age group. You cannot look at the young, so people will do pediatrics or do aging, and you forget what's in between. So the life cycle is from birth to death. And as I said, if you have this anthropogenic model, you'll see the genetic impact, the impact of drugs, your metabolism, mental and oral health, how interdisciplinary working across universities, not just in your own country, not just in your own city, but globally. And this is a really good forum to do that. We forget that there's frailty. So you might, if you're in a developing country, have frailty when you get to quite an old age. But actually, frailty occurs from birth. So if you're in a country without resources, your frailty profile is already going to infect you during gestation. Next slide. So I'm sure you've all seen this. This is my framework. I always have it up because Professor Hadil, you must have governance and policy, right? So you cannot do anything if you don't have a governance framework. And this is one of the programs I work through. It's satellite connections, where we have a global network which feeds out to local communities, hospitals, universities, and local community part of this is very important, because when you don't have broadband, if you don't have internet, good satellite connection might help. And could I say to people in Africa, look at your satellites. There's huge amounts of satellites all over Africa, which have been mothballed, which could be taken out and used and make Africa really a lot more independent. Next slide. Okay, so what do we do with crisis? We must have a crisis management plan. There needs to be a task force. This can be at a government level, but you must have a local plan. So what do you do if you're sitting in a small town in South Africa, or you're sitting in London? What do you do when there's a crisis, which we've all had, totally unforeseen, descended on us? Were we prepared? Was there planning? Do we have response? How do we build resistance into our systems? We can no longer say we don't have the money to do that. It has to be in place. So if you take here in London, through my university and the hospital and the medical school, really it's working across all sectors, national agencies and charities. And I also think that the international charities, a lot of countries should feed into that. Embedded in your education system, embedded in your health, embedded in everything, and try and innovate. You know, when it happens, you can't do anything about it. If you've had planning, you can. Next slide. So this COVID descended on us, and there was loads of plans nationally. The UK had a plan put in place in 2016. There was plans through the university, plans through the hospital. But we have a very diverse community, 49 languages spoken just in our hospital. And we had a lot of vaccine mistrust, a misunderstanding. As everyone knows, the internet was a real nightmare. So we worked under the radar, which I think is also really important. It's your community. What do you need? We don't understand what everyone is saying. We made posters in 19 languages. And we got local people to take copies and put it in their shops, in their butchers, in their pharmacies. And we made a waterless soap available to a lot of countries who couldn't afford, and where we couldn't, we sent the recipe abroad. We didn't think anything would happen of this because it was so local. But then one day I was watching the BBC News and I saw our poster in Glasgow, and they were saying localism is the only thing that works. Next slide, please. So how do we innovate and make commercial partnerships? Now, we are a huge organization, WASD, and I work with other outside organizations as well, not only through the universities, but if you harness the universities, the big organizations like this, the Diaspora, we can make a huge, huge difference. And then there's innovation in therapies. Use your local community. They have actually a lot to contribute. I think people don't realize that the Americans used to send scouting parties across Africa, and a lot of the drugs that are available came from local communities sharing their information. Next slide. Okay, so you can go from East London nationally and globally, but actually you can go from Kimberley, you can go from Istanbul, you can go from Mongolia and do something locally, all right? We've got big enough groups to make a difference with lifelong learning, with innovation. Work together with crisis prevention. Not everyone knows, okay, those who have expertise help. And then look at your environment and health systems and how that could also contribute. Next slide, please. Okay, so I'd like to stress that the knowledge management has to be defined by local people. So my thing is, think globally, implement locally. Local people, the only way it's going to be sustainable is if local people are allowed to have ownership of both the knowledge and the leadership. And I think if you listen to Prof. Gonca, it's actually saying, you know, Africa is such a huge resource. We have to start taking ownership, exactly like India did. And I think, you know, could be, it's the largest continent. You know, the maps are all wrong. However, you have to have better communication. You've got to have better electricity. You can't have outages all the time. You can't be spending 10 times the amount of your salary on electricity in a small township than I spend on my electricity in London. Those infrastructures have to be sorted out so that communication could be a lot better. Next slide. Having done all of that is actually, we don't know very much, right? Look at, in the top slide of the slide there, that is Matera in Italy. I went there, I was just blown away. It's a cave town, so sophisticated, you would not believe it. 40 years ago, the Italian government moved everyone out. But what a resource. You're going there and it's like 38 degrees outside, 2 floors down, equitable temperature, brilliant. Now, international hotels are moving in to utilize the area. We lived very well. We lived with environment. And look at Matata as well in Tunisia. People are now moving out. But again, it looks like holes in the earth, but it is sophisticated living conditions. Should we be thinking of those again? My friend from Iran told me that her grandparents, all in the north of Iran, where it was very hot, lived 2 floors underground during the summer. Do we think we're so fantastic at cleaning up our mess? No, we're not. In Egypt, they are much, much better at recycling. Nigeria is much better recycling than anywhere in Europe. Can we live at 50 degrees? You know, the global north says, oh, this is going to be a problem, whatever. Actually, loads of people are already living. My father worked in temperatures of 50 in the summer. He was in the Sinai desert and everyone was saying, is that your father? He's got so many layers of clothes. My father knew to keep the temperature equal about your body, he used a lot of layers of clothes. Wake up, global north, listen and look around you. These are young children, the orange shirt children who are building canals, the HIV orphans who get training over the weekend. Does anyone know where Malagasy is? Okay, they are using local materials to make light. Okay, so amazing. Look, you know, if you look up on the internet, the number of herbs they are, that's medicinal, there's over 1 billion, 1.5 billion. And then look what people do locally. This is in Zimbabwe. This is a medical camp. This is local people taking ownership, raising money themselves, a little bit of help at the beginning. They're very good at doing their own projects now. And this is their new medical center. So next slide. Okay, so what my university has a commitment to excellence. I do believe that everyone here has a commitment to excellence, and this just by working together, we could do wonders. Those are the people who were in my school when I was head of school. We do a away day when the students told us what they thought we were wanting in, and we told them the other, and we all worked together to innovate. Do not forget your local communities. Remember, innovation doesn't come when you have 10,000 images in your brain from the internet. It's when you're bored, when you're sitting out in the sun. If you look at the most innovation, it's come that way. We were already using fuelless cars 20 years ago in South Africa when there was embargo. My father's lorry went 2,000 miles across Africa on methane from debris, which they collected along the way. So look around you and give everyone an opportunity. And if we all listen to each other, work together, we could do really well. I'm passionate about this. Thanks, Prof. Alan.
So please remember, if we all help and do a little bit, it will make a big difference.